Hey there, we are back on SportsLine. Steve Layman here with you tonight, and we are joined in studio by Dr. Alex Diamond, who is very involved in the health of athletes in our area, around the state, even around the country. He's the team physician for Vanderbilt, the Nashville Predators, several area high schools, and he is helping to put on the Youth Sports Health and Safety Conference at Geodis Park up this Friday for team physicians, for athletic trainers, for school officials, for parents even. And again, registration 7 o'clock. The program starts at 8 o'clock, runs till 4. You can learn a lot of interesting stuff, but we'll continue the discussion here on the program as well. And Alex, we talked a little bit about parents and how they want to be involved, but there's also a level of when you drop that kid off to practice or school or whatever, you sort of just trust they're in good hands and everything's going to be fine. How involved should parents be in this topic when their kid goes up to be on the football team or on the volleyball team or soccer team or whatever it is? How concerned should they be? How involved should they be when it comes to the health and safety protocols?
Yeah, I think it's sort of two aspects. I think concern versus involved, two different. I think, you know, in the end, it's your child, and no one cares more for that child than you. And so you have to be an advocate. And I always tell folks, never be afraid to be an advocate and stand up for your child when it comes to their health and safety. That's what matters the most. Certainly say that when I see my patients as well, and that, you know, certainly I want them to participate. I want them to have a great time. But sometimes, you know, you have to address different injuries in different ways, and in the end, that's what comes first, and then we'll sort of go from there. But I do think, you know, there have been great strides made. I think there are a tremendous amount of organizations and who really care about the kids' overall health and safety and well-being. And you know, most people involved in sports are really dedicated, well-meaning folks who give of themselves at the detriment probably to a lot of times of their families and their other things to be there for these other kids. And so I certainly support all those folks who are involved in school-based sports and youth sports. So I think, again, it's a team effort. And so I think as a parent, it's important to be engaged. It's important to be an advocate for your child. But it's important to work together with that league and that coach to make sure things are being done the right way. And I certainly think some of the steps that are being put out there, not only by TSAA, but some of the recent legislation to make sure that's done in a good way.
Most of the time, kids are under great supervision with their teams throughout the course of a 9-month school year and athletic calendar. Right now, we're sitting in the month of July, which for a lot of people may be the time when your kids have the least supervision, when they're working out perhaps on their own in a gym that there are no school supervisors or trainers sitting around. Maybe they're running outside or running the neighborhood hill to try to get that conditioning in before football practice. What would your message be to parents or to those athletes themselves as they do that training on their own to best prepare themselves but also be careful?
Yeah, I think certainly these last couple of weeks, it's no more important now than ever. It's hydrate, 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 and it's just brutal out there. And so you don't want to start from behind. So if you're dehydrated, you're already in trouble. And what I always tell our athletes is a healthy athlete, a well-conditioned athlete is the best performing athlete. And so take care of your body, and it goes to hydration, it goes to nutrition, it goes to sleep. All those things are vitally important for performance, as well as injury prevention and the health of that athlete. And those are simple things that can be done. And so the American Academy of Pediatrics has recommendations by age as how much sleep each child, teenager should be getting at night. And that's really important. And you've seen that a lot on the professional level, bringing even sleep specialists to talk about how important that is. You know, it's not that often anymore where there's late nights for the guys when there's a game the next day. And so I think that's a critically important area, sleep. Nutrition, hydration, again, taking care of your body. And then I think something called acclimatization, which is sort of getting used to being active again in this heat. And so you don't go from 0 to 100. You don't go from no equipment to pads and helmets, shoulder pads, and everything. And so it's a stepwise progression, and you want to do the same. I think the other thing that we've seen too, we used to talk a lot about making sure we get rest in between seasons, and that's still important, but we're also seeing is that we don't want to completely shut people down, because otherwise you're up here with your high level activity, season ends, you shut it all the way down, and then you got to do the steep ramp up. And that's where we see a lot of soft tissue issues, a lot of overuse issues as they get back into their sport. And so, yeah, you do want to rest and modify, but you want to keep some baseline level activity. So we want to encourage kids to continue to work out. I think playing multiple sports is good too. And so even if you're a basketball player, get out even with your friends. Play football, play tennis, play golf. Do other things to work other muscle groups and stay in shape.
The more and more I talk to college coaches, no matter what the sport, they seem to really identify those kids that are able to play multiple sports. Yeah. They may be a football prize recruit, but they kind of like it when they see them on a basketball court or a baseball field, because it shows a little versatility in your athleticism.
Yeah, there's just different muscle pattern movement groups, with each different sport that comes naturally, and all that can do is benefit you in your primary sport. And it also again gives you some sort of modified rest where you're still working out, you're still being active, but you're not constantly using your arm as a pitcher. You're doing other things that benefit you during core work and lower body work that can only benefit you as a pitcher later on.
You mentioned, I guess, sort of the 3 pillars of setting yourself up for success: hydration, especially this time of year, nutrition, and sleep. And I was just over at the day 1 of the Predators development camp earlier today at Centennial Sportsplex, and I noticed on the itinerary they have a nutrition session and they have a sleep session. Yeah. Team physician, you might have a hand in that, I don't know, but the pros are certainly talking about it. So what are the guidelines if you're talking not necessarily a pro athlete, but if you're a parent of a 16-year-old kid who has aspirations, or you are that 16-year-old kid that has aspirations, how much sleep do you need at night? What should you be eating as you prepare yourself?
Yeah. I think the first point is there's no reason that your young athlete can't do the same things that the pros do from a health and safety perspective. We always look at it from a participation standpoint. Do they have all the bells and whistles and the fancy tournaments and the gear and all those things? And that's great. That's fun. But we need to treat those athletes the same way that we do, provide the same level of health care, provide the same level of support to our young athletes. And again, simple things like sleep and nutrition. And so on average for a general teenager, they should be getting about 8 hours of sleep a night, which again, everyone's lives are jam-packed and packed in, and with things, whether it's from school or sports or family related, and that's important. But sleep is not the thing we should be skimping on as part of it. And I think there's so many different nutrition recommendations out there. It can really get confusing. It gets confusing for me. I'm not a dietitian. I'm glad we work with really smart dietitians, because there's so much out there and it's easily to get confused. One of the big topics at our conference this Friday will be from one of our nutritionists who works in our adolescent medicine clinic at Vanderbilt, also works with a lot of our athletes at Vanderbilt. But there's something to be said for just a good old-fashioned, well-balanced nutrition. Again, there's little divvies of areas you can get, much deeper in. I'm sort of way oversimplifying it. But I think the other part about it too is making sure you get enough calories for what you're doing. I think that's a big thing that we tend to see in a lot of our youth athletes, particularly our female athletes, is that you think about your body as an athlete. It's a high performance sports car, and if you're not putting gas in that car, it doesn't run right and it starts to break down. And so not only do you need those calories to function, but you also need it to rebuild. And so when we exercise, muscles break down, bones break down, and so you need those calories to be able to build yourself back up.
I was just going to ask, as you talk through that point, the differences, and hard to ask a wide-ranging question like this. I understand it's easier when you get down to a specific thing, but are there general differences between the male athlete and the female athlete that you see as you try to train them to, one, have the best performance that they can, but also to avoid injury?
Yeah, I would say big picture, no.
Okay.
Having worked with both teams, both groups are committed, dedicated, amazing athletes that inspire me every day. I would say, I think from a science standpoint, a big issue that we always hear about is ACL tears. So tears of the anterior cruciate ligament of the knee. It is well documented that female athletes, particularly high school age, college age athletes, much higher risk for ACL injury than their male counterparts. There's lots of different theories for that. But the good news is there have been prevention programs that have been developed over these last decade or so that focuses on ACL prevention. They've been shown to be very highly effective, and the group that's been shown to be the most effective in is that adolescent female athlete. And so if you have an adolescent female athlete at home, you need to have them on one of these ACL prevention programs. It works.
That's good to know for sure, because that has been a topic amongst people in sports for the last couple of decades at least in this particular aspect. One other thing I want to hit on before the next break, because we sort of talk about training and athletes. We're at that point of the year again right now where a lot of them aren't in their school seasons and all that, but they're very quickly going to come back. And whether it's football or volleyball or soccer, whatever it is again, what's the most common injury you see when people get thrown into it?
Yeah.
And what's the easiest way to prevent it?
Yeah, I'd probably say in that scenario we tend to see a lot of stress fractures. I would say even coming out of COVID, when there was sort of that shutdown and all of a sudden sort of got the go-ahead to say, go back to sport, and everyone was just chomping at the bit to go and went from 0 to 100 really quickly. The amount of stress injuries, stress fractures, stress reactions that I saw in clinic seemed to be, again, the most that I've seen in a long time. And anecdotally, talking to colleagues across the country, they were seeing the same thing. So I think if your season's starting up now, in the next month, now's your time to start getting yourself built and build that base. So that way when you get back to school, again, there's always going to be increase when you get to the coaches. They're going to push you a little harder than you always push yourself, but you're not going to this gap, you're doing this gap.
I feel like this would be kind of similar in terms of the preparation to try to avoid that when you get there, but something we saw last year and really over the last couple of years, particularly with the Titans in training camp. And those guys aren't just sitting on their couch like pounding ruffles during July. They're getting ready, but yet they show up for training camp and it's a different level. Yeah. And we've seen a lot of soft tissue stuff, whether it be hamstrings or just pulled muscles in general. Is that just kind of a reality when you start up something like that every year, or is there something really you can do? Because again, they're running. It's not like they're out of shape. Is there something you can better do to that, or is it just kind of part of it? Yeah,
I think for those guys, it's a little bit part of it, because they really are, the majority of them are doing the prevention programs, and they're staying in shape, and they're doing all the right stuff. They're just, pushing to such a level that I think some of those things happen. Again, I would assume most of them are doing the prevention things that we talk about. I think what's important for kids and teens is that, yes, soft tissue injuries still occur, but what we need to really be aware of is that kids actually tend to break things and have growth plate issues and bone issues before they actually tend to have more soft tissue injuries. Again, that's not an absolute, but the growth plate is a much softer part of the bone, and it's actually weaker than the muscles and tendons that connect around it. So it's the weak link. That's what tends to go first. And so we tend to see stress fractures. We tend to see growth plate fractures. We tend to see what's called an apophysitis, which is an inflammation of those growth plates. And so don't be too quick to sort of brush off your child or teenager's pain at the beginning, thinking, oh, it's probably just a sort of soft tissue soreness, so they're getting back into it. It may be something more to it.
All right, there's a lot to look into. There's a lot to digest here, and we've got much more coming up with Dr. Alex Diamond here on SportsLine tonight. Stay tuned. News Channel 5 Plus back after this.